Hello, and welcome to the Natural PCOS Podcast, the podcast dedicated to empowering women with polycystic ovarian syndrome through natural approaches. I'm your host, Dr. Samina Mitha, a naturopathic doctor with a passion for women's health and hormones. Each episode, I'll explore the latest insights and my personal experience to help you manage your PCOS naturally. Together, we'll dive into practical tips, inspiring stories, and the latest research to support your journey towards balance and wellness. Let's get started on your path to thriving with PCOS naturally. Hello, everyone, and welcome back to the Natural PCOS Podcast. I'm your host, Dr. Samina Mitha, and I'm a naturopathic doctor who helps women with PCOS. Today, we're talking about this question that I think a lot of viewers out there have, or I should say listeners too. Should I be dairy-free, especially if I have PCOS? Because we know everybody, I feel like, is talking about dairy online, that we shouldn't be eating it. And today, I'm going to really break it down for you and let you know what you should consider for yourself, your own, plan, because everyone out there is different. And I want to give you some of the information that I know and my personal experience with dairy. So let's get started. The first thing is, what is in dairy that is actually causing some of these issues? Believe it or not the lactose. A lot of people think that they are sensitive to the lactose in dairy, and it's not the lactose. It's actually something called casein. This is the protein that's in the dairy that's actually causing the sensitivity. The immune system is responding to this. So it's really important to note that if you think it's lactose, you go lactose free and, things don't change. It's probably because you're actually sensitive to the protein in dairy. So removing all dairy products and finding alternatives might be your best bet. When we look at dairy and we're talking about, what are some of the symptoms that can show that you have a dairy sensitivity? Well, number one thing, honestly, I think of is if you're constantly getting stuffy noses, because dairy has a really good way of increasing mucus in the body. And if you're constantly getting sick, or, you're around people who are sick, and then you will get sick for sure, and you usually get sinusitis or something like that along those lines, inflammation, lots of mucus, then it could be a dairy sensitivity. Another really obvious one is, digestive concerns, loose stools, bloating, gas. Bloating is such a big one. All of my patients who come off of dairy, they tell me, I just feel less bloated. Just feel like my body feels less inflamed in my digestive system, which is so true, because even for me, going dairy-free, that's the number one thing that I found. Another thing is eczema. If you're noticing that you constantly get, eczema, you're more prone to asthma or allergies, seasonal allergies, things like that, and then you have the eczema, you really could be sensitive to dairy, and you should consider removing it from your diet. Now, I just want to say that, having an allergy is a completely different than having a sensitivity. An allergy, you will see hives, you will see itching. So if you have something like that, you might actually be allergic, but this is more of a sensitivity. It's not this clear immune, fire. When I think of an allergy, I think of fire, these hives, burning sensation of itching and redness. This can be a little bit different in terms of the symptoms that someone's experiencing. The other thing I really want to emphasize is, can you test for a dairy sensitivity? Now, there is a food sensitivity test that a lot of patients will use to actually figure out if they're sensitive to any foods, where this test is actually pretty helpful. But at the end of the day, I used to run this test a lot actually in the beginning of my practice, but I kept finding that a lot of times dairy and gluten would come up. And these are foods that, we most commonly eat. So I wasn't sure, after a few years of doing it, I was like, is this actually dairy and gluten? And actually, a lot of people went dairy and gluten free and they felt a lot better. So that was another sign that, these are really inflammatory foods. And if we actually take out dairy and gluten and not take out all the foods that come up on a food sensitivity test, actually a lot of it can get better, and the patient doesn't have to remove every single red item that is coming up on the food sensitivity test. If we just remove the biggest inflammatory foods like dairy and gluten, a lot of times all the inflammation comes down, and even the foods in the red get better. And one of the things that really prompted me to think about this was sometimes healthy foods were coming up in the red, and that made no sense to me. And I realized that, this is because there's so much inflammation and it's all coming from dairy and gluten. And if we use those two, we bring those out, a lot of times things can get better overall. So food sensitivity test is great. I think it was helpful, but it had a few caveats like, are these foods people are most commonly eating and that's why it's coming up? Is this just what's happening in the immune system at this moment in time and it's not really giving us a trend? So then I decided, I'm going to stop doing this test and get my patients to start doing an elimination diet because we know this is the gold standard test to actually figure out a sensitivity. I often actually was telling patients to do an elimination diet, but it's actually extremely hard and you have to be very committed. And sometimes I feel like if you have something on paper that says in the red, you are sensitive to dairy and gluten, this just gives you more motivation. So a lot of patients would actually end up doing the food sensitivity test before. But if you literally want to know right now, today, you could start today, you can do an elimination diet. You take out the dairy from your foods and you wait and you see like, do my symptoms get better? Is my energy better? Is my sleep better? Is my skin better? Is my digestion better? You look at all these things and then after 4 to 6 weeks you put the food back in and you can see if it actually makes things worse, makes things completely the same as before, or better. And so you really want to try this for a few weeks. But that being said, oftentimes I'll tell my patients, just do it for 2 weeks. Do an experiment on yourself. Go dairy and gluten-free for 2 weeks and see what happens. And a lot of times they actually find that within 2 weeks, they know for sure if they're sensitive to dairy. And they actually don't want anything to do with dairy after that. Which is really interesting because I actually once had a patient who really had immense amount of pain. She almost ended up in the hospital after that meal. I think she ate lasagna, actually it was. There was a lot of pain, and I think she didn't know. She was really scared. Like, what is going on with me? She came to me and there were some signs of endometriosis. And with endometriosis, we know it's a very inflammatory condition. So we removed the dairy, removed gluten as well. And she felt significantly better, like less pain in her period, just less pain overall. We know in PCOS as well, there's this low grade inflammation throughout the whole body. And if we can remove these most inflammatory foods, we can make such a big impact on how the body functions on a day-to-day basis. So really important if you're noticing that you have signs of inflammation. What does this really do to the body? What is dairy actually really doing? And what's the problem with dairy? One of the biggest things is that dairy can actually increase insulin and make insulin resistance worse because of that. The more insulin we create, the more insulin resistant we become. And then on top of that, we know that dairy can actually increase testosterone, which is another problem for PCOS women because we make more testosterone in general already. So if we can actually reduce dairy in our diet, even if you bring it down to not eating it 80% of the time and only 20%, you might actually see a big difference in your cycles, in your insulin resistance, and especially in your skin. I find that many women who are dealing with cystic acne when it comes to PCOS, they're finding that removing dairy from their diet makes a big difference to their skin. Because we also know it has something called insulin-like growth factor, which can actually impact the skin and cause acne as well. So if you're out there, you're like, I'm just so confused about dairy, but you have all these symptoms, I would really consider doing some kind of an elimination diet. Do you have to be dairy-free forever? I really feel like you don't. You don't have to be extremely dairy-free. And that's just really a personal choice. I always tell patients when they figure out they're sensitive to dairy, it's really up to you. You know what reaction your body's going to have. So it's just a matter of you deciding, if you want this reaction to happen. And also, sometimes it's not just the dairy itself, just eating a small amount. Maybe it's the amount of dairy the person eats. Oftentimes patients will tell me like, I ate a whole pizza and like that will really impact my body. But if I just eat one slice, I'll be okay. And I really feel like you just have to kind of see what works for your body. When I was going dairy free, one of the biggest things that I realized was I just need to take it all out. I took out milk I think milk is a big problem for a lot of people, because they'll find that they'll take out milk, but they'll still be okay with a little bit of cheese or a little bit of yogurt, but milk is like really impactful for them. And when I took out milk, oh my gosh, my body just felt so much better. My insides, my digestive system just felt so much calmer. Just like this little pillow coming onto my body and just being like, you're okay now, because it just like the feelings and sensations that were happening in my digestive system, I didn't even realize that until I went dairy free. And I had really bad cystic acne as a teenager, and once I found out I had PCOS, I was working on candida in my gut and took out dairy, but I wasn't like completely dairy free for many years because I thought it was actually okay. But I realized once going into naturopathic school, I really need to take it out, and so I've been dairy free for a very, very, very long time now. But I think probably over a decade now. So I think for me, it really makes sense. And I stay away from milk, cheese, butter, yogurt. Oftentimes people will ask, is eggs okay? Yes. Eggs are not considered a dairy product. Eggs are considered protein. So it really includes milk, cheese, yogurt, and butter. And the biggest one I think is milk. So really important to take all of them out as much as you can if you're trying an elimination diet, put them back in and then see what happens. And I think a lot of people are considering being dairy free, and it seems so scary, and it feels like you're never going to be able to eat dairy ever again. And that's not the case. Like you can, have some dairy here or there. I'll be honest, I even have some dairy sometimes, like milk chocolate, especially around Christmas time, because chocolate is everywhere and Valentine's Day is now coming up too. So sometimes you can't get away from it, but I do find that if I eat even just the slightest amount of milk or milk products or anything like that, my skin can get really impacted. And that's me. But, experiment with yourself, see what happens. And yeah, I hope this was really helpful to explain to you a little bit about dairy, how it impacts PCOS. And if you have any questions at all about this topic, please let me know. Really excited to share this with you today. And hopefully I'll see you in the next episode. Bye, everyone. Thank you for tuning in to the Natural PCOS Podcast. I hope you found today's episode insightful and empowering. Remember, managing PCOS is a journey and you're not alone. For resources, tips, and to connect with our community, visit my website at saminamitha.com. You can also find me on Instagram at dr.saminamitha.nd. If you enjoyed this episode, please subscribe, rate, and leave a review. Your feedback helps me to reach more women seeking support for PCOS. Until next time, take care and stay well.